Well, hello and welcome to all of our Gold viewers here today. I'm Fiona Langsharp, IBCLC, Director of Communications and MC here at Gold Learning. Well, it's going to be a great summer here at Gold with many events coming up, including this one. We have a fantastic event coming up for you here at Gold, and I am sitting down here with Carmela Kika Baeza, who is going to be participating in that event. And of course, that is our Gold Learning Level Up Your Lactation Skills. So welcome to Kika back here at Gold Learning. It's so lovely to have you here.
Thank you so much. It's always an honor to be asked to come back again. Thank you.
Absolutely. Well, Kika, I am always delighted to sit down and chat with you. I must mention as well, for those of you listening in, that Kika is also part of our professional advisory committee here. We value your insight so much, Kika. We
Mhm.
always have some fantastic feedback, resources, and research from you. So thank you for always being part of, that programming here at Gold. We treasure you and respect so much the work that you're doing. And so I would love it if you could actually just sort of reintroduce yourself to everyone listening today, tell them where you are in the world and what you do there.
Mhm. Well, I'm an IBCLC, and currently, well, I'm always in Madrid, in Spain, in Europe. Very beautiful country, really hot right now in summer. August is the hottest month here, and so we're all going to the beach and trying to get fresh air somehow.
Yeah.
And this country is very young for lactation
Mhm.
care. There's only very few of us IBCLCs. We're growing, but it's a very, very young profession here. So it's very exciting times, and everybody's wanting to learn more and to help better.
Oh, that's wonderful. Now, tell me, Kika, what came first for you? You're a physician as well, a doctor. Were you interested in lactation before or after? How did it all come about for you?
Well, I actually no, I was not interested in lactation at all. I did family medicine,
Hmm.
and as for many, many people who end up in the lactation field, it was a difficult breastfeeding um, relationship with my first child that got me into breastfeeding. There were things that,
Ah,
you know, my son was born with a heart disease, so we had to be in the NICU, and he just couldn't breastfeed. I had to pump and pump and pump, and I
hmm.
couldn't even be with him. And when he was 25 days old, he passed away.
Oh, Kika.
And yes, it was very harsh. This was 19 years ago already.
Yes.
But for me, the thing was, how is it possible that I'm a doctor? I'm supposed to know about this, and there was no way I could, help my baby to breastfeed. I would have loved to have, for those 25 days, imagine that I could have
Sure.
breastfed.
Hmm.
So then I started to study and read, and I remember the first time I saw a book about breastfeeding, I thought, what? How can there be a whole book about this? It's so
Yeah,
simple. Turns
it's
out.
true. It's true.
So that's how it all started. So,
Oh,
that's
wow.
18 years
Wow.
ago. Hmm.
Well, I mean, that is such a touching story. And, sincerely, I'm saddened to hear of your loss and, my heart goes out to you, having a heart child myself and being part of that NICU and,
Hmm.
also feeling a little bit lost. I was fortunate when I went in that I was already working in the field, but that
Hmm.
you end up helping so many people in there. But
Right.
today, just briefly talking about heart disease, it is still quite wearing on families in the NICU when they have a heart child. Still a lot of myths, happening. And so I still find myself, and I don't know if you get the
Mhm.
questions as well, but there are still some things that, that they need support with in the NICU and understanding about these very special babies in order to support the families to breastfeed them. So it's a very challenging time, and
Mhm.
statistically, still 1 in 100 babies are born with heart disease. So,
Right.
the numbers are still high. And so it's
Mm.
something that comes up fairly frequently. Do you get an opportunity to talk to families about that, Kika?
I usually see them since I have a small private practice, which
Yeah.
is outpatient. So I usually see them for follow-up. They get referred
Oh,
to me often
wonderful.
after they come to the hospital.
Yeah.
So it's more, how to get them back into normal life.
Sure.
and support them that way. So I
Yeah.
get the easy part now.
Well, I say that comes with, I mean, that comes with a lot of baggage. When you've been in the NICU and you've been through
Yeah.
possibly some surgery or,
Hmm.
any amount of emotional turmoil, it's great to have someone that really understands
Hmm.
in your court, in your
Right.
community, that
Right.
can support you. So that's
Hmm.
wonderful to hear as well. Kika, tell me, how have things been for you in Spain, in Madrid during the lockdown? I know
Hmm.
you had been talking a little bit about this online and some of the struggles that had taken place. Were you able to do consults online? What did it look like for you?
Okay. Yeah, the situation here was very scary, and it's actually starting to look bad again, unfortunately.
Hmm.
But yeah, lockdown, it just all went very fast. We didn't know like till 2 days before that it was going to happen, and then it did. And then
Hmm.
for me, like the big problem was just not only that we couldn't do breastfeeding consultations, that we had to start doing them online, which we'd never done before. For me,
Right.
it was very difficult not to be able to assess a, a suck, to watch a feed really well, because it's not, watching it online, it's not that easy.
No.
And but especially the big problem, I think, is that there were mothers had no access to pediatricians, so we were getting all
Mm,
the calls not just about breastfeeding, but also about
right.
well baby. The parents didn't know if the umbilical cord was looking good, or if the baby's color was well, or so it was all
Yeah.
these consultations, and it was really difficult for everyone, I think. For me, certainly, I think I'm not an online consultation type of person. I had a
Right.
very hard time.
Yeah. Yeah. And I was really grateful actually. It was two things that came up in the time when things were starting to get very challenging in Spain
Hmm.
before it hit really bad here in North America. But I took your advice. And I don't know if I ever told you that, but I remember messaging you, asking if you're okay, and sort of learning what was happening. And we prepared a lot here because of you. And so,
Right.
thank you for sharing so much and being always so generous with, even though it was a very trying time for you and there was lots of missteps in what were happening, in your country,
Hmm.
but it gave me a foundation on preparing as well.
Hmm.
So, and I know that we're certainly not out of things. We're still in a pandemic, and we recognize
Hmm.
now this is something that we're going to have to live with for some
Right.
time. And so we're finding new ways to
Right.
manage, things. What sort of things have come up for you that you think are, that now you're sort of in it? Are you doing things differently? How is it impacting you sort of in the long term now? What has changed for
Hmm.
you?
Well, I think we've definitely changed the way we have to work, like physically, how we have to change the space, how we have to,
Sure.
um, we can't see women one after another now. The families, we have to space the visits and clean everything up in between. So it's
Right.
it's really made it, more complicated, and
Yeah.
and and long term, I really can't say, because I can't, it's day by day now. I don't know if we're going to have another lockdown or not.
Sure.
I don't know. They are trying times, certainly.
Yeah, for sure. I guess it's sort of being prepared for, whatever happens and taking it a day at a time.
Right. No, and I mean, now we're looking at it with more confidence, because we have the previous experience,
Yeah.
and we can draw from there and keep on learning.
Absolutely. Absolutely. Yeah. Well, I think having a platform like Gold where we can share internationally, where we can come
Hmm.
together and learn, certainly lends to the education that we can get. And
Hmm.
so again, focusing back into what's coming up here, we're going to have a really great, solid day of learning, including yourself. And then, of course, we'll have three other presenters that are going to be with us as well. There'll be 4 LSERPs to earn, and of course, other credits that you can get. You can join us.
Hmm.
You're going to be with us live on the day, which is
Yep.
fabulous. That's August 17th. And what that means for folks listening in today, if you haven't been with us before here at Gold, it means that Kika will be not only doing her presentation live, but she'll also be spending time engaging with you, the delegate. So it means that we can exchange information. We're going to do some engagement questions and polls. And then, of
Mhm.
course, we'll have a live Q&A where we can really get to the nitty gritty and ask all of those questions. So I think that's something we were talking about, how much we love that,
Yes.
to be able to do that. So I know you're looking forward to that as well, right?
Yes, I love that because it gives me the chance to also learn because questions are what make you think and say, oh, maybe, there's a better way to do this. I think
Yeah,
it's so very important to be able to listen to everybody around the globe, their
that's
thoughts and
right.
their experience. Hmm.
Yeah, yeah. And particularly about your topic. So let's just talk briefly about the topic and what to
Hmm.
expect. The topic is assessment and management of mastitis.
Hmm.
So tell us, do a little bit of a quick dive into what we should expect on the day and what we can, get ready for.
Hmm. Okay, I would say very briefly, we're going to go over the main aspects of the classical mastitis, which sadly sometimes it's not still not well managed, although the management is pretty simple. It hasn't changed in these later years. And then there's also all kinds of other types of mastitis cropping up,
Mm,
subclinical and subacute and chronic, and all these terms that are kind of confusing and not very clear. So I'm going to love going over those and explaining to everybody what they mean and if they're truly useful or not in a clinical setting. And then finally, we're going to talk about if there are any new ways of treating or of managing or mastitis. And I'm going to especially talk a little bit about probiotics, which have a lot of people who are pro probiotics and against probiotics.
right.
So just
Yeah.
look at the evidence and see what we have.
Excellent, excellent. Well, that sounds like it's going to be a great deep dive. And of course, the whole point of having our Gold Learning Day was to level up, our lactation skills. And I'm really looking forward to
Hmm.
taking that to the next level. I think, for me, it's one of those things where mastitis it seems to come hard and fast. And I think it's something that you really should be prepared for and ready.
Hmm.
And so any information that we can work out together and I can learn from you, Kika, I'm really going to be grateful for. And of course, to all of our delegates too, come and join us on the day, live August 17th. You can also, of course, listen to the recording. We'll have forums open for a discussion as well. And if you want
Hmm.
to, you can actually pop comments and questions right below here listening to us today, and we'll get those ready also for the live event. So for
Great.
Kika as well. Thank you, Kika. It's just always great to see your smiling face and sit down and hear what's happening in Madrid with you. So thank you for joining me here today.
Thank you very much, Fiona. It's a pleasure.
And thank you to all of our audience. Don't forget, you can register right now. You can go to our website at goldlearning.com and join us for our Gold Learning Day. Level up your lactation skills. We'll look forward to seeing you live on August 17th. Bye bye for now, everyone.